The knee pathway was set up after a year of successfully running the hip pathway. The purpose of the pathway is to improve a patient's access earlier in their treatment to options and alternatives to surgery, as well as to improve likely outcomes. Timely access to this information helps patients to participate fully in decisions regarding the most appropriate course of action to help them manage their knee pain. The pathway also aims to help patients understand the cause of their condition and the likely outcomes of available interventions. It ensures that patients who require surgery are appropriately referred and given preoperative care, and it allows patients to fully participate in decisions about their care pathway. By giving patients a structured education programme which explains about the disease, self-management options and the evidence to support this, as well as explain about knee replacement surgery and its benefits and its risks. Giving appropriate prehabilitation has been shown to reduce post-operative recovery times as well as improve post-operative outcomes. Our education programme aims to ensure that patients who are referred into secondary care are suitable and ready for surgery and properly prepared so as to enjoy the best possible outcomes. The pathway ensures more joined up holistic working between primary care, physiotherapy services and secondary care. The knee pathway is not just for patients who require surgery. It is for patients who have moderate to severe osteoarthritis of the knee that can no longer be managed in primary care, but the patient does not necessarily require surgery now or in the future. Initial management strategies for patients with osteoarthritis of the knee include reassurance and patient education, weight reduction in patients who are obese, so particularly those patients who have a BMI of over 35. These patients should be referred to Live Well Suffolk for more guided dietetic advice. They should be advised about appropriate walking aids if they're not already using a walking aid, and be guided on a patient-specific exercise programme. Please see the OA Knee section of the website for more detail on this. Patients should be advised about wearing cushioned and supportive footwear, as well as about the use of medication, which should typically include analgesics and non-steroidal anti-inflammatories. The referral criteria onto the osteoarthritic knee pathway is knee pain that can no longer be managed with simple analgesia and basic physiotherapy. There should be X-ray evidence of established osteoarthritis of the knee, and it is important to remember that an X-ray alone is not indicative of a need for surgery. You can access the knee pathway by giving your patient a self-referral card. The patient can then refer themselves either via the internet or over the telephone, where our senior clinicians will triage the referral directly onto the pathway. We also accept referrals via the NHS e-referral service as well as paper referrals. All patients referred onto the knee pathway will be seen and assessed by a senior physiotherapist within 20 days of us receiving a referral. The patient will start their programme of care within 3 weeks of their assessment if they are referred to stage 1, which is conservative management, and if referred to stage 2, which is preparation for surgery, a referral to secondary care will be sent that same day. Stage 1 is for patients with moderate or established osteoarthritis who require conservative management. The patient will either be seen as a 1-to-1 or receive 5 1.5-hour group sessions, which will cover the following: general fitness and flexibility, strength and mobility exercises as supported by the NICE guidelines, weight loss and dietary advice, pain control and management including a pain DVD, advice regarding smoking cessation, a discussion and video footage with an expert patient, and these are patients who have had knee replacement surgery, as well as discussion regarding equipment and walking aids if required. The patient is then reassessed on completion of their 4th session to re-evaluate their goals and outcome measures. Their physiotherapist will contact them again at 1 and 3 months after this appointment for a telephone review. You will be kept informed of their progress throughout the programme of care. The focus of stage 2 of the pathway is to prepare the patient for surgery and refer them to their chosen secondary care location. They will receive initial assessment with us within 3 weeks of us receiving the referral. They will be referred on to secondary care after that initial assessment, as well as receiving up to 3 one-to-one sessions in preparation for their operation. You will be informed of what is happening and receive a copy of the orthopaedic referral and where it has been sent. All patients entering the pathway will complete an EQ5D and an Oxford Knee Score. This is repeated again once they are discharged from the service. We also use a patient satisfaction survey to gain patient feedback on the service, and the results of these are reported on regularly. All patients who complete either stage of the pathway are given a satisfaction report to complete on their final session. The results of these have been fantastic and very rewarding to staff. Over 90% of patients completing the surveys found the information very relevant and felt that enough time was spent delivering information. Patients reported being pleased with the handouts and presentations which supported their learning. 90% of patients felt that the service fully met their expectations, and over 90% of patients completing the pathway reported a 50% or more reduction and improvement in their knee symptoms.